just want to speak from personal experience about healthcare. I had, as I said, 150 people there at the last. I was state chair of the Associated Builders and Contractors one year, and I saw my healthcare costs going through the roof. It was, started out, family coverage was $200 a family in the 80s, and got to be $900 a family or something ridiculous there toward the end, and it's just out of control. There was a bill before Obamacare that the ABC was pushing in Washington. I was over there helping lobby for it. I think it was about 2005. And Senator Byrd was actually a co-sponsor with Olympia Snowe. And the big idea was to let healthcare companies cross state lines and eliminate bureaucracies and spread the risk. And that was going. It was going to go, and at the last second, Bob Byrd pulled his support, and it just died. And I think that's the last meaningful effort on a federal level to promote meaningful healthcare reform. And until we got up this Obamacare, we need to, I agree totally, we need to be the 27th state to sue and get rid of it. But we need to look at things like that and get our congressmen and our national people to go after efficiencies like that. And in West Virginia, we have a lot of regulation on state level we need to look at in the healthcare industry. I heard Mitch talk about the Healthcare Review Authority. I can speak personally from that. The construction of hospitals is through the roof because of that very authority. It's out of control. But we need a free market system. It's back to my Reagan principles about less bureaucracy, less regulation. We can have lasting growth, and we can have lower healthcare costs. Sharon has a master's in community health, and she was on the statewide quit line for smokers for a while. And some of the people you talk to are unbelievable. They really wanted to quit, but it was so hard for them. But we need to promote wellness. We're like the most obese state in the country, and we're the, I don't know what we are in diabetes and some of the other problems. If we can promote wellness, we can go a long way toward lowering our healthcare costs and making it more affordable for people to live in the state. Wellness is something that people just take for granted sometimes, but you got to get out every day and walk. You got to keep your cholesterol down. I have a cholesterol problem. I sat about 3 weeks ago with Tom Jones, head of the WU hospitals, and I asked him what his view was on healthcare. He said, well, simple, we need to make everyone in the state have a system like we have here at the hospital. Now, he goes in every month, gets his blood work done. He knows what his cholesterol is, his blood pressure, and his body mass index. He said, if you keep that at a certain level, you have this rate. You have a really good rate. If one of those is out of whack, you go to the Class B rate. You have two of them out of whack, you go to the C rate. And if you're a smoker, you pay this. So if you're personally responsible for how much you pay in health care, you take better care of yourself. We need to come up with a system statewide to do that. I know it's not an easy thing to do, but we got to start somewhere. Thank you.